Because severe obesity is a chronic relapsing condition, follow-up visits are critical to long-term weight loss. Remind your patients that the band is not a cure, but rather a tool to help level the playing field. It is a treatment that requires lifetime commitment and therefore a commitment to follow-up visits with our team of experts. But it is your responsibility to provide your patients with the necessary conditions for optimal follow-up visits. Establish a schedule for follow-up visits with your patients. Follow-up visit schedule. A minimum of 1 visit per month during the first year post-surgery is the recommended frequency. This can be increased as needed for challenging patients. Many programs schedule bi-monthly appointments the first few months, then decrease the frequency depending on the progress. The initial post-op months appointments should be scheduled before surgery. A very good process that successful practices consistently report is the requirement of scheduled visits. No one should leave your practice without their next appointment scheduled. Patients should not be advised to call or come in when they need to. Rather, routine, frequent, scheduled visits should be the norm. Beware that patients may be more enthusiastic about visits at the early stages of treatment and require vigilance when it appears they have reached a cruising weight loss speed. Treatment failure, for a wide range of reasons, will be their previous normal experience. Patient compliance must be actively developed and enhanced. How available are you and your team? How welcoming are you to your patients who are doing poorly or have given up? How do you deal with those patients who do not keep their appointments or are not being followed up? Do you send out reminders? Does someone call them and remind them of their appointments? Do you try to re-engage your patients? Do patients perceive value out of the appointment? Most practices have come up with strategies to overcome these obstacles. For instance, most practices have mechanisms in place to track which patients have not visited or contacted the practice after a certain number of months. Reminder calls are then placed in an attempt to re-engage the patient. Reminder calls are important to reduce the frequency of cancellations and no-show appointments. Daily follow-up calls are helpful to re-engage patients. Automated texting reminders work very well also. Having a plan to re-engage patients who are no-shows for appointments or cancel and refuse to reschedule is vital to long-term follow-up. The tone and language used with the patient are very important in this case, as it is probable that the patient might be dealing with some issues that explain the lack of compliance. An example would be, "Sorry we missed you at your appointment schedule today. When can we reschedule to see you again?" The concept of an open door policy has also gained in popularity among the leading experts to provide better accessibility, especially in the case of an issue that could be linked to a potential complication. Additionally, several practices have now set up satellite offices to better accommodate patients that live far from the main practice. In some cases, as many as 6 satellite offices have been set up, and a surgeon and/or nurse practitioner visits each satellite office once a month for a half a day of follow-up visits and/or adjustments. Other practices have established telemedicine options to overcome geographical and transportation barriers to long-term follow-up. Make sure you discuss the following with your patients. Patients clearly understand the benefits of compliance and the consequences of non-compliance. A partnership has to be developed between the patient and the practice based on trust and understanding. That means you need to be a good listener and refrain from dominating the conversation during visits. Be empathetic. Patients fear being judged or reprimanded if they're not doing as well as they perceive you expect. You need to control the frequency of contact with your patients. Visits, calls, emails, texting, even a newsletter can play a critical role in your patient support system. These recommendations particularly apply to those individuals suffering from both the physical and psychosocial challenges of severe obesity, as they've often experienced discrimination and stigmatization from healthcare professionals. Follow-up visits should discuss 1. Eating behavior, small bites, chewing them well, and waiting a minute between bites. Eat only when you're hungry and stop when you're satisfied. Avoid snacking between meals, but plan for a healthy snack if one is needed. 2. Exercise. Incremental increase in the appropriate physical activity and exercise. 3. Adjustments. Timely and appropriate band adjustments to maximize satiety. Make sure visits include education, support, encouragement, and dissemination of new information, and reinforce all aspects of living successfully with the lap band system, working on enhancing patient understanding regarding the prevention, early detection, and management of post-surgical complications and behaviors that interfere with optimal results.